Okay, we are live. Let me
hmm
play our theme song here.
As the clock strikes 7, the vibes alive. Inner circles here where voices thrive. Turn on your screens, let the magic unfold. Listening and healing as stories are told. Come on, come on, this is your time. No topics too tough, just heed the calls. From mental health woes to justice we seek. Together we rise for the strong and the meek. A safe space for all, let's lift every voice. In a circle podcast where hearts unite. Sharing our truths, bringing hope to the light. Community strong, we're never alone. Together as one, we've created a home. With laughter and love, we break down the walls. No topics too tough, just heed the calls. From mental health woes to justice we seek. Together we rise for the strong and the meek. A safe space for all, let's lift every voice. So join the conversation, let's set the tone. In a circle podcast where love is well known.
Hello, hello, welcome everyone. Welcome to our guest wherever you're watching us from. Today is Wednesday, December 15. Time no more than we
January,
huh?
January 15th.
Sorry. What did I say?
December.
Oh, okay. You see, I'm still in the Christmas spirit, I guess. Yeah. Today's January 15. We are normally here around 7:30, but we're trying to wrap up some stuff, so sorry we are a little bit late. But today is going to be a great one. I got my co-host here, Miss B. We are here at you every Wednesday. This is our the reason why you have a light crowd, right? This is our boring segment every Wednesday, right? We're discussing money. And money is a boring topic. We're discussing finance and business. So tonight, my co-host and I are going to be going over the recent job numbers, but specifically focusing on like specific sectors, so healthcare, hospitality, and some of the opportunities they provide for immigrants like us, and things like that. So, we're talking these numbers. Is we immigrants, right? We don't really like hone in on the economic data. When someone talk about the jobs report, what it is, you know what I mean? You be thinking to yourself, I mean, what are you talking about? Well, how does it affect me? How does it affect my personal economy? So tonight, we're going to hone in on that and dive deeper into the recent jobs report. And then there's another one that came out today, right? The inflation report. Like I know you have been hearing a lot about that inflation, how grocery prices are so high, rent is so high, everything is so high, and things like that. So with that, first though, before we dive into things, just want to again, right, continue to pray for the folks in California, especially in the Los Angeles area. The loss of life, the destruction of properties. We want to, and our prayers are up for them. So it's like keep, if you can afford it, donate to the Red Cross, please. I know they are doing a lot of great work out there. So please, pray for the people of LA. It's a great city. It's hard, it's tough to see so many destructions of life and property. So our thoughts and prayers are with those folks. So with that, again, there is an Inner Cycle podcast. We bring you relevant topics that kind of affect our immigrant community, Black community, and things like that. So tonight, we're going to be discussing, as I said, like healthcare, hospitality, and opportunity. That's our topic for tonight. How immigrant drive growth in key sectors like healthcare and hospitality. So, Miss B, welcome.
Good evening, everyone. It's your girl, Miss B, and I'm excited to be here tonight. I'm always about the business that pays me and standing on that business. So happy to be here tonight. How are you doing, Abe?
I'm pretty good. I'm pretty good. I know whenever it comes to these topics, these things. As I said, it's a boring topic for our community. A lot of folks think, okay, how does that relate to me? Right? We're talking about money and finance. I just want to make my money. I don't care how. I don't care. I don't care. I don't care
I
about
think
anything
they're just
behind.
uncomfortable. It's not a
Mm,
topic that we traditionally talk about in the household, and so they're uncomfortable. They don't know how to have what's their point of view,
mhm,
and the amount of unknown is such an unknown area when you talk about finances, the stock market, and all those things we're going to get into tonight. It's
mhm,
that fear, the fear of the
mhm.
unknown, like anything else. I think it's why we don't talk about it more.
Yeah.
But
I think though, you know what I mean? I think from my vantage point, it's very, very important, especially like
very,
the topic we're going to focus on tonight, right? So it's like, as I said, the jobs report, like every month in the United States, Department of Labor Statistics come up with a job number. Like I think the first Friday of every month. So last week Friday, they came out with December jobs report, and the economy kind of created, according to them, the economy created 256,000 jobs, right? I mean, that it seems like a lot, but for a huge country like this, you know what I mean, and stuff like that. But it was just in line with, with forecast and expectation, right? And the key thing we want to hone in tonight, right? Out of those 256,000 jobs, 46,000 were in healthcare. And when you really look at it, who are those mostly in healthcare? Let's be help me out here and educate our audience, So.
The health field is a field that we have a very high percentage of folks, not
Mhm,
just as far as Black people, but specifically when we talk about the African immigrant community.
mhm.
A lot of Liberians are in the health field in different aspects, right?
Yeah,
When we
yeah.
talk about health field, I wish we could not that I wish, I'm glad we're having this conversation so we can let people know of all the various other positions that
Mhm,
are even more high paying in the health field, since it's a field that we seem to like, right?
mhm.
There's like I said, there's a high percentage of us that are in the health field, especially here in the state of Minnesota.
Okay. Yeah, I mean, it's like if you look at the report, right, about it said nursing, so that home healthcare alone was like 15,200 jobs, right? And most of those, like, so
Yep.
if you look, yeah, you know what I mean, and things like that, like out of that numbers, and you said like nursing and residential, and these are where like nursing and residential facilities where it's had like about 14,000 plus jobs, right? These are sectors where in like you have, to your point, right, African immigrants, especially Liberians, right? It's where you really find them and things like that. So these numbers is like if you have someone in that sector or in that industry, it is important to you. Let's assume like, hey man, maybe like it's a local nursing home here, or maybe you work at a group home. You say, I want to change jobs. These numbers that are coming up that they bring out every month, right? Is like it is really, really important because number one is like if your employer is not treating you right or you're not making enough, you can say, what, I want to base on the employment numbers, right? My sector is creating jobs, there are a lot of jobs in there. So like, hey, I do want to switch, right? I do want to probably, to your point, I do want to probably scale up. I just don't want to be a CNA forever, right? I do probably want to scale up and find something that can, meet my skill level.
Yeah. So just here in Minnesota, there's 37% of African immigrants that work in the healthcare field
Okay.
compared to other percentages of immigrants. So just, yeah,
37%.
37% of African immigrants work in healthcare field here in the state of Minnesota.
Oh wow, that's a huge percentage. I mean, it's
It
like
is.
I mean, that's a huge percentage. Why is that? Why? I mean, why's that? Why so much concentration?
We're just more likely to work in the healthcare than any other immigrant groups in the
Mm-hmm,
healthcare field, and
mm-hmm,
that could be high and low skilled positions, right?
mm-hmm,
I feel like when you think about the opportunities in the continent, and I shared it, and some people were kind of shocked. You
mm-hmm,
find a lot of Liberians going into the nursing field, even in Liberia. You find a lot of us. We have this ability to want to care for people and nurture people.
mm-hmm.
We if you think about it, we do it in the home anyways. We're most likely the women are most likely culturally to be in the home, providing that nursing type services to the family and caring for elderly parents.
Mm-hmm.
When people are sick, we tend to care for the sick. Even with the limited knowledge that we have, it tends to be us who care for the sick. And
Okay.
so it's an easy entry role here, especially when you talk about the lower income positions for
Mm-hmm.
us when we come. And so that's why you see a lot more African immigrants in that field.
Okay. Like I know, like I don't want to say, right, we had this argument back, on another segment where we talk about I won't like to, I don't want to go back to that right way and like to say that it's a low wage, right? It's like, but the pay in that sector, especially healthcare, it's not that high compared to like other sectors. Why is it again, right? Why is it like, I know like, because of our background, because we like to take care of each other, because we like to nurture each other. But there are so many other sectors right there that are high paying, right? I mean, technology, finance, it's like um
People, people,
consultants,
yeah,
so many other things,
but
right? why
people
is
need
that
to
why is it that why is it that can we like get away from healthcare and like get into those other fields?
But people need to realize that every field has its, like they said, high skilled and low skill.
Hmm.
America compensation is determined based on, is it a high skilled job? Is it
Hmm.
a job that requires a degree and the level of education that you need? All of
Yes.
those things America uses to determine the skill, the pay, I mean the pay scale, the pay scale for
Hmm.
that job. And so people should not get offended. Even if I'm a healthcare worker, at some point, at some level, the position I'm holding may end up being a low wage position. And they have levels, because again, you will do a home health aide, a PCA, then you do a CNA, you do a LPN, you could do a RN. They have 2 year RN, they have bachelor's RN, they have masters in nursing, and then they have nurse practitioner. By the time
Yeah.
you're a nurse practitioner, you're entering into the doctor level type of a field. So uh, I'm sorry, but at some point, depending where you are in these different levels of the healthcare field, you may fall into a low income job, even though you may have put in a lot. What you feel is a lot of effort. It's still not. It does not equate. A nurse practitioner is no. A CNA is never going to equate to a nurse practitioner. These are the levels that you're taking to get there, but you're not there.
Yeah, even though, yeah, I get that point, right? A CNA is never a nurse practitioner, but why ever want to be a nurse practitioner? Because of, it's like I have to do my doubles, right? To earn, to pay my rent, to take care of my family. And there's no time, but you have a lot of immigrants in this situation. It's not that they don't want to, right, advance themselves or grow in their jobs or at their company, but it's just that it's so tough, right? It's like because you have to juggle so many things, and sometimes that's the thing. That's the trade-off immigrants face in this country. You come here, so now the first place you find yourself, right, is like healthcare or maybe hospitality. Working at a hotel or something like that. To grow becomes difficult because sometimes you have to do doubles or work 2 3 jobs just to. We talk about ends meet. Last week, right? Just to make. Just to feed your family. So it's not as easy as you are making it seem.
It's not as easy, but what people fail to realize that,
Mhm.
especially when you think about America, your age and your accomplishments, they go hand in hand. Life
Mhm.
is has they have a trajectory plan for you, right? You have to think about why there are certain jobs you're going to find more teenagers doing those jobs, and we feel like their skill set, their skill level is not there, their experience is not there, so we tend to pay those jobs lower wages, right? And if you follow the trajectory in which the American culture society wants to happen, is like you leave high school, you go to college, you get to college, you get into the work field, right? And you're in your job, you got that experience, and you can either, to increase that pay level, you're either getting that experience and you're moving up in that company, or you're also educating yourself to the next level, right? And so sometimes people do a field because it's easier to increase myself in that field. Of another reason why you see people in the healthcare field, because I can easily transition from being a home health aide into the nursing field because some of that experience is there. Then I'm going to transition from being a home health aide and being an engineer.
Yeah. Well,
Yeah.
specifically though, right? I'm not talking about someone who just coming from high school, right? Who has options, right? Someone who went to high school, yeah, have options. Obviously, there's so many other fields they can go into. There's so many opportunities. There's so many options. I'm talking about someone coming here with their family, right? Immigrant, or maybe whether they come here single or with their family, right? You come here at a older age, and the first thing you got to get a job, right? you know, and the place to get a job as the December jobs report reflect, right? It's either healthcare, hospitality, or sometimes manufacturing, right? These are places where it's easy to get into. You don't necessarily need experience or education. And someone when you get in there, to get out or to grow, it's hard because, hey man, you gotta, like we just talked about. I mean, another topic we might be discussing on here, like on this segment or on this show will be, I mean, remittance, right? It's like, but you got to send money back home to your family. You got to feed your family here. And so sometimes, right, to even take the time to advance yourself, right, to go to school, to maybe, I mean, to get a 2-year nursing degree, as you alluded to earlier, it becomes difficult. So you are just stuck being a CNA
Very, very
because that is
difficult.
just because that is just a 2 weeks license. I mean, license that you need, or certificate, 2 weeks or
Yes.
3 weeks or 1 month.
Three
I mean, that's
weeks.
easy
Yeah.
to do. Yeah, that's
Three
easy
weeks,
to
depending
do.
where you go, the maximum 30 days, depending
Yeah,
where you
yeah,
go.
yeah. So that, I mean, those are the challenges a lot of immigrant face. So it's like, and healthcare, month over month, year over year, it's a growth sector. It's a growth industry, and it's easy to get a job there, right? Is I know. So it's not that necessarily our people want to be in there, but it's a place very, very easy to get into. You don't
At the
need.
end of the day, what
Mhm.
are the two things you're going to do with a human being? You're going to take care of them, or
Yeah.
you're going to educate them. And so that's why, right? And in between taking care of them and educating them, the luxury of being able to stay at a hotel, or go to a restaurant is what they're going to indulge in. And so those are unfortunately, as much as we have AI and we have all this technology, mankind is still very simple. We
Mhm.
really are. And that's why you continue to see these growth. Again, it's a field that has a high demand, and it can be easy depending how far you want to go and build yourself in the healthcare field. Then it tends to get harder. So if I'm, like I said, if I'm ending at the lower level, lower skill, lower amount of education requirement, it's going to be very easy. That's why people go into it, right? But if
Mhm.
I want to continue to grow in the industry, and which some people don't go past it, because then it gets hard. That's when the real book business kicks in, and it
Mhm.
gets difficult, and then they just continue to stay where they are, and they say, oh, you know what I didn't accomplish, my child or my children hopefully will be able to accomplish it.
Yeah, but sometimes it's not so much, right? Is that maybe the book business? I said sometimes it's just trying to uh
Balancing
bal-
life, yeah.
balance those priorities, right? Balancing
Yes.
life priorities and things like
Balancing
that.
life.
Yeah, yeah, balancing life priorities. So, folks, tonight I said we are discussing the December jobs report. Right, in December, the economy created 256,000 jobs. Out of the 256,000, 46,000 was in healthcare, and 43,000 was in hospitality. If you had travel and you stay at a hotel, most of your cleaners, most of your stuff, they're immigrants, and that's why we brought this topic here tonight to discuss that, right? The role that immigrants play in these sectors, right? To keep this economy, to keep America moving, basically, right? To keep things homey, right? Sometimes I know you feel a lot of, I mean, we just got done with a huge election, right? A consequential election. And there was a lot of debate about immigrants, even the new administration, a lot of focus on that. But one thing some of the things you don't hear in these debates or in these arguments is like, I mean, immigrants played a huge role in this economy, played a huge,
Oh
huge
yeah.
role, right? In healthcare, in hospitality, as you say, if you travel before, every hotel cleaner I've ever encountered, they are immigrant.
Oh
Almost.
yeah.
you,
Oh
you
yeah.
know, you know.
Yeah. And before we leave the healthcare thing,
Mhm.
I want people to know there's a lot of high paying fields that are non clinical healthcare careers, right? That people don't even think about, like healthcare administration. Oftentimes, when you think about the person that's running ACMC clinic, that person has just a business degree background,
Hmm.
and they're making six figures, right? And
Mhm.
so just because you see somebody working in the hospital does not mean they're carrying a doctor or nurse degree. There's other different degrees that they have that are positioning them to be in there,
Mhm.
and will be telling that doctor or that nurse what to do, but not necessarily are they a doctor or a nurse. So don't downplay other positions that can pay you very well in the healthcare field, that does not have to be a clinical, a paying or a clinical or physician type position. Dental hygienist. You don't even have to be a dentist. You can be a dental hygienist and still make really good money.
Hmm.
The people who do the radiology, the MRI technicians, they make really good money. Your X-ray technicians, they do X-rays all day. They make really good money. Your ultrasound people, they're making really good money, right? And
Now,
oftentimes,
do they like someone who's doing like ultrasound at hospital? Do they need a degree or something like that to get into that field, or just a certificate? Do they need a degree, a
most of
4 year
what I've
degree?
mentioned have been
Uh-huh.
certificate programs. They're not even like degree programs. Yeah, they're certificate programs. X-ray technician, that's a certificate program, and you can make really good money. Anesthesiologist is a degree, but you still make, it's not like a medical degree, but you still make very good money as an anesthesiologist. You're talking about six figures, high six figures as an anesthesiologist. And you may find an anesthesiologist may even be making more than a nurse practitioner sometimes, depending on their level of skill and experience, and if they added a degree to it.
The one thing about healthcare, then sometimes I'm always intrigued, right? I know it's a good sector to be in. If you love taking care of people, if you love people, if you love to be around people, but it's a stressful industry. It's a stressful sector. So I'm always
Yes.
amazed. Why is it that our people are drawn to that? Why is it like, I mean, because there's so, I mean, you could go into finance, you could go into retail, right? You could go into so many, you could go into manufacturing, become technology, and so many other opportunities in this country. Why is it our people are so much drawn to healthcare? I mean, as I know that, I mean, sometimes like, you hear the money. I mean, like when someone is a nurse, oh man, I can be like of money. But sometimes when I look at it though, I say, hey man, it's like I'm in finance, and so now if you compare my salary to a nurse, I mean, I mean, there's even a comparison there. But it's like you have so many of our people, right, just in healthcare. It's like I'm amazed by that.
It's because some of it too can be your passion about, you like finance, you like numbers, you're passionate about that, so that's why you went into it. So I feel like there's a lot more people who are passionate about the field that are in it, and not necessarily only because there are certain areas or level of the healthcare field that are easy to get into. I think
Mhm,
it's about passion. It, to me, it's very physically demanding, right?
mhm,
But that's what I noticed, like the more degrees you have, the less physically demanding your job is, the more
mhm,
money you start to make if people really sit down and look at the whole picture and the whole environment. Because
mhm,
again, our RN is not going to be doing the work of a CNA, right? So the CNAs, they have the hardest part, right? They are the ones who are really at that bedside. They call it bedpan side with that
mhm.
client, providing all those really serious cares, taking care of the wounds, giving the baths, changing them. That's the CNA. The RN, 9 times out of 10, they're passing meds. They're administering the medication all day. They're going around with their cart, and they're administering their education, which rightfully so, because they have put in more work, more experience, and more skills. And so, therefore, they've earned the ability to do less work, but it's still more important work, honestly.
Okay.
Giving somebody a bath versus giving somebody a narcotic, just think which one is going to be more serious.
Okay. Here's another dimension though, right? With healthcare continuing to go year over year, as a month over month. Let's just get away from maybe you getting a job in there, but is there an opportunity, especially for the immigrant community, for African immigrant community, like to maybe, maybe like establish businesses, right, in those sectors, right? Maybe a group home. I mean, that's one thing that is really, really popular. I have noticed with African immigrants.
More and more of us are opening group homes, opening assisted livings, opening multiple location, multiple homes, right? Because of our years and experience in the field, we have found that it's a lucrative business, and we are transitioning more into that. So that's some of the good things. And then we're more likely to hire in our community, where we're serving, or we have established our business. So that
Mhm.
helps too with them when we talk about the employment gap and closing that employment gap. It's good that there's more of us that are getting into that field, because we're going to hire more of our people too.
Yeah, I mean, and to that though, is there like a low barrier of entry into establishing a group home? Is that what it is? Because I see like, I mean, I see so many people trying to go into that. Is there a low barrier of entry?
It's not. Sometimes you could wait 2 years before you actually get the license, right? To be able to operate. And then once you get the license, now you have to get clients. And just because you've opened your group home does not mean clients know you exist. And so there's this level of marketing and making those connections and building those relationships and networking just to get your first house filled. Once you get your first house filled, staying open is a whole nother thing, is right. You get the state comes, they conduct different tests, they come unexpectedly sometimes. And so keeping those
How do
group
you
homes.
how do you even get clients? I mean, that's something like how do you like if I say, hey, I want to get into the group home business, right? I have to probably get my licensure from I mean my state Department of Health. But how do I get
DHS.
clients? How do I get clients? How do I go about
So
getting clients?
you would think that the first thing that a person, when they're looking for a place,
Hmm.
they look at the state registry, and so you're going to be listed on there, right? But still, that
Oh,
doesn't really tell somebody about you. So that's one advantage. At least there's a registry where you'll be on listed, right? And
mm-hmm.
then from there is like you have to start building your relationships with these case managers, because the
Mm.
people at the hospital, the nursing homes, are the ones who are responsible for helping their patients to get placed in a facility, right? And so most oftentimes what happens is those case managers build relationship with certain facilities or certain group homes, and that's how they channel their clients to those facilities to get those services. So it's going to take some work with any business, right?
Yeah,
It's
yeah,
going to
yeah.
be some work. You have to network, you have to build those relationships to get those clients in there.
Now, what's the difference between like a residential nursing home facility versus a group home? I mean, what's the difference in there?
So the word group home is not even the legal term. We the ones started
Okay.
calling it group
What's the
home,
what's the legal
and we have
term?
influence. And now, honestly, the
Because
state does call them group
that's
home.
how I hear people call it a group home. It's
Yeah,
like,
we have influenced the legal terminology for it to become a group home, but they weren't called group home. I can't think about the legal term right now for it. But so there's assisted living,
hmm
and there is nursing homes,
hmm
and then there is where you call group homes. So it all depends on the facility size and the services the facility is going to offer. Yes, that was what determines what type of name it's going to have and what level of license it's going to require.
Okay, okay.
And
I mean, that's
sometimes
good. Uh-huh.
it depends what type of patients or clients you're going to have in there. So you could have people with mental disability, with physical disability is different, or you can have elderly care, or you can have youth homelessness, youth mental services, there's different buckets of people and different types of needs that they have, and your facility can get licensed to do maybe multiple things, because depending on the clients that you have in your facility.
So who pays for these clients then? The state
Um, the
or the
state is
insurance?
paying for these services, their insurance is paying for these services, and some of it is private.
Oh, okay. So if the
Yeah.
person doesn't have insurance, the state cover is right. But if the
Yeah.
person have private insurance pays for it.
Private insurance, or they have money themselves. Oftentimes, wealthy people who are living in these assisted living facilities, it's a combination of their money, their retirement money, their social security money, or maybe state, depending on their income level, is going to
Okay.
pay for their services.
Yeah. Well, folks, tonight we are discussing, opportunity that exists, in our community, in the immigrant community. And tonight we are specifically honing in on healthcare and hospitality because the latest jobs report that came out last week, Friday, the December jobs report said there was 256,000 jobs. The United States economy created 256,000 jobs. Out of those, 46 in healthcare and 43 in hospitality. Hospitality meaning like restaurant, hotels. If you have traveled before, hotels, events and all the other stuff and things like that. So, and I think right, not only like getting a job in there as Miss B was just discussing, but it's also there are opportunities right to create a business. And I think, as I said, I have encountered or hear about a lot of immigrants, establishing what we call in our community group home. That's the term that I know. I don't know the legal term, right? But owning group home business, some of them like own two, three homes and things like that. Um, so that's what we are focused on tonight. If you want to comment, you can put a comment in our chat. I know anytime we're talking money, business, and finance, a boring topic. Folks don't like to hear it, but it is very, very important that we bring these topics to you. We let you know. We try to break it down what it means for our community, what it means for us, and how can we take advantage of it, right? Because we shouldn't just sit and complain, oh, the economy is not working for me. When we don't take the time to educate ourselves, when we don't take the time to learn these very, very important things, right? Every month, right? The Department of Labor Statistics put out a job number, a job report, and sometimes when you really dive deeper, it affects every one of us. No matter what sector you are in, it affects us. But tonight we are just honing in on the sector really, really that impact the immigrant community, which is healthcare and hospitality. Do you want to say something, Miss B?
Yeah, I want to say people may find it boring, but I want you to tune in because we talk about businesses, right? As we're talking about jobs being created, just think about these are the businesses that need to be created too, right? That these jobs are not just so a business is what creates the job, right?
Yeah.
So just think about that means that more businesses are being created in this field because of the need, right?
The
Especially here
demand,
in
the
the state of
demand, the
Minnesota,
huge
the
demand.
demand.
Yeah.
Yeah, especially here in the state of Minnesota, we've lost 33% of our nursing homes got lost, right? And so right now there's a huge demand for more groups home, and we're gonna expecting an increase significantly for until 2045 and a peak in 2047, where there's going to be a high demand for nursing beds throughout Minnesota, especially when you think about rural areas. A 45% increase, that's a huge demand. And
Yeah.
so, who's going to fill that demand? That's you, who all have been in this field for a long time now, can transition from working for somebody and owning your own business by opening your assisted living facility and opening your group home. So, this is a great show to listen to because you'll get the demand for what what jobs are being created and the need and stuff, and then also think about what businesses then need to be created as well.
If it says like, I mean, the state of Minnesota lost a lot of nursing home. Why is that? Is that because was that due to the pandemic or what was going on there?
I got the data the other day
Mm.
at work, and I'll look for it while we're chatting, but I'm not sure exactly what it was. There, I mean, there has been a history of abuse happening in these different facilities. The
Oh, okay.
turnover of getting them sold, like Saint Therese, it used to be Saint Therese in New Hope. They just got sold for the second time in December, August of last year. And so the name has changed now. And there at that facility in New Hope, you have a large Liberian population working there, right?
Mhm.
And the state is always there. And sometimes the best thing to do is what, get a new owner, do a name change and give something a better look to get
Branding,
to
branding.
rebranding to lose that negative connotation behind it. But I say that to say we are the ones there already, right?
Yeah.
How nice it would have been for us to be able to buy that facility, right?
Yeah.
Sometimes we need to think beyond what's right in front of us.
Mhm.
Oftentimes we stay in these jobs for so long, we're in these businesses and they get sold every day right there underneath us because we don't make that connection.
Right before
Seriously,
our own eyes. You're definitely right
right before
because
our own eyes.
yeah, yeah, because the thing is, right, as we are discussing, as I've been saying all night, we avoid money and finance and business topic. Why?
Yep.
Because we feel so boring. If I bet you, right, if this was a gossip show tonight or something, or talking about man, woman, being a man, I bet you, man, it was gonna be hot off the press right now and things like that. But to your point, right? There are a lot of facilities, there are a lot of things, right, that are happening right before our own eyes. But because we are not passionate about it, we are not into it, we feel so boring. We are not taking the time to really, really well get into it because the healthcare sector so is really, really growing, especially in Minnesota. There's a huge, huge need. There's a huge
Yes.
demand, right? And to your point, right, it's like sometimes people, I mean, there are clients out there that the last time I was listening to a Hennepin County report case, right? They want to put most of these juvenile, they are looking for homes for them and they cannot find it. Right?
Yeah.
It's like they are looking
Yeah.
for homes for them. They cannot find it. So it's like it is we bring this topic on this, I mean, on Inner Cycle podcast every Wednesday to discuss these things because we feel like right, it's going to benefit our community. It's going to benefit us, right? Is that because we are here, we need to participate in the economy. We cannot just be on the sidelines, right? We need to get involved. We need to do something. Something needs to happen, right? We cannot say, oh yeah, that doesn't affect me. That doesn't bother me. Oh, it's like, hey, the economy created 46,000 jobs. Who cares, right? I mean, in healthcare, right? Who cares, right? Doesn't bother me. I got to get in, go to work every day, but it does. It does affect you because, to Miss B point earlier, right? It is an opportunity for you to say, maybe what, let me go and open a group home, right? How can I learn about that process? How can I go about doing it and things like that? So,
And another good thing about watching this show is that we can tell you because certain jobs, because of the demand, right? Certain businesses come with grants. I know people are look probably at your beauty salon. I'm sorry, your barber shop, or you want to open your clothing boutique.
Hmm.
There aren't grants out there for that, but because we have a high demand for domestic violence shelters, for youth homeless housing, for nursing homes, Hennepin County and the state have so many grants, millions and millions of dollars. There's a grant right now, I believe, Hennepin County
Hmm.
has out there that's probably due next month. And anybody who knows me and knows the work that I do, when I get these emails, I share them out to people who have group homes and are in this field of work. But
Sure.
they have grants right now to help with housing, for
Hmm.
homeless housing and senior housing, right?
Yeah.
And if
Yeah.
you are somebody looking to open this business, it's a great opportunity to apply for some of those resources that can support you to open your business. Because I know
Hmm.
there are folks who want to buy the home themselves and then open the home, right, and turn that
Hmm.
home into a group home.
Hmm.
Well, it's different than when you're buying your residential home for you to live in, than if you want to buy a home in Hennepin County and turn it into affordable housing, or if you want to turn it into senior housing or turn it into youth homeless housing. There are grants out there for those type of businesses, right? And
Hmm.
so you don't have to do
So can
business alone. You can
yeah,
do
so
it with the help.
can a private business get a grant? I mean, to go after these things?
This is exactly what it's for. It's for private companies to
Uh-huh.
have these grants to
Okay.
open these facilities. Um, During the pandemic, what
Hmm.
Hennepin County did was they reached out to different hotels to be able to
Oh,
house people. Yes, to
okay.
house the homeless. And a lot of these hotels now the county has ended up buying, or they have a contract. La Quinta in Brooklyn Park,
Uh-huh.
right, is
Yeah.
now owned by Hennepin County. Yeah, the county has purchased that for housing. The
Really?
county is not. Yes, the
But it's
county is
still,
not.
it's not a hotel anymore?
It still functions as a hotel, but you have people doing long term stays in the hotels. You will find like these Super 8s, these Motel 6, they have
Uh-huh.
turned into housing. Yeah, these lower I see I don't want to put anybody's business down, but
Yeah.
these lower quality hotels, they're staying afloat, and there's a huge demand for them because they have turned into long-term housing for people, believe it or not. And some of our county dollars and state dollars are subsidizing folks being able to live in these hotels. Again, you will find a lot of people in the Indian community are buying the La Quintas, the Motel 6,
Yeah, I mean
and
that
the
is
Super
something.
8.
Yeah, definitely because
Another
if they are
another industry.
if they are getting government contracts, right? And that's the thing, right? There's a great segue to the hospitality industry, right? Because
Yep.
these
Yep.
hotels, right, is that because of the homeless crisis, right?
Yep.
Is like as I said, there's a need for housing, right? And you cannot find it, the state or the county, or government cannot find it. So they are utilizing those hotels.
Yeah, the hotels are home to Ukrainians. If you think about the amount of Ukrainians that came, they're being homes to Ecuadorians, folks that are coming here or are
Hmm.
receiving refugee services. Those are the folks. And again, now you don't need to rely on Abraham coming to stay in your hotel. You have a government contract probably for the next 5 years, because we want to be stabilizing housing, especially when we talk about families and
Yeah,
refugees coming here. That's a 5 year contract you have with the county, guarantee money to pay for your beds, right? They're paying
yeah.
per bed, or per hotel room,
Hmm.
that you don't have to worry about.
Yeah. I mean, definitely, man. I think that's why to me, I think, we need to bring topics like this every Wednesday. We need to discuss business and finance every Wednesday because you learn some great information, great information, right? And folks, right, we are sitting down in this country, in our community, things are happening and we are not participating. Wealth are being created, we are not participating. We are sitting on the sidelines and just watching all of folks getting rich. To her point,
Yep.
sometimes you go to somebody Motel 6 owned by Indians, right? You go to the
Yeah.
local, yeah. It's like it's a man, what's going on here, right? I thought like I mean the hotel business is a Caucasian business, but
No.
no,
No.
no, it's like
Latinos are in there. The Radisson in what used to be the Radisson Brooklyn Center at one point changed hands into a Latino investment group. Own it.
uh
Yes.
yeah.
In
So I
Brooklyn
think
Center.
I think right, it's like that's one of the things I think Inner Cycle Podcast is going to push. We need to open our African investment group so we can start buying things around here, right? We need to start
Yeah.
buying things around here. We cannot just be spectators, or as you said, right? We are. most often we are just invited to the dinner table and been eating for a meal,
Yes,
right?
we're on
Yeah.
the menu. Yeah.
Yeah, that's why you like to say we are on the
Is
menu.
it? We are
Yeah,
on the menu. We're not at the table. We're on the menu, and that's
yeah,
bad because people
and
at
we
the
cannot
table
just
are passing you around, talking about you.
yeah, we cannot just be employees in this economy. We need to start thinking
Mm-mm.
about ways we can, yeah, 256,000 jobs in December is great, but we cannot just be part of that number. We need to be the ones contributing to that number in a way where we are the one creating those jobs. And it's easy, right? Like healthcare, hospitality. These are things. I mean, to Miss B, like the point Miss B raised earlier, that's the info I just learned that Hennepin
Yeah.
County is what providing grants to private businesses to open homes, right? It's like
And it's
to
nothing new. Second Harvest Heartland comes and buys a building in Brooklyn Park or opens a building. Let me tell you this.
Mhm,
Corporations are the biggest recipients of welfare in this country, and people
mhm,
don't realize that. Job creation is the number one thing any legislator wants to say they have done. That is their legacy. I created jobs. And right now, when you go and Google, and as we're talking about the jobs, that's what the
mhm,
Biden administration is going to highlight how they've
yeah.
created the most amount of jobs in history during his administration.
And that's the point. I mean, that's a great point, right?
Yeah,
Biden just gave his farewell speech later on tonight. The first thing he said, right, during his 4 year time in office, his administration created 17 million jobs.
16.5, yes, 5
Well,
million
16, yeah,
jobs
16.5,
for
almost 17
17
million.
million. You're
Yeah,
right.
yeah, yeah. 17
I
million
I
jobs,
I
right?
I
Those are the
process the
things to talk
same thing.
about, right? Yeah.
Yes,
Those are
every
the things.
legislature talks about job creation, and so not to cut you off, Target, Walmart, Amazon coming to to Shakopee or buying a warehouse. Second Harvest Heartland, $18 million they got in legislative dollars to buy a building, to buy land, put the building there because why? Maybe 100 jobs got created. So that's how they equate the value of giving money to businesses and not being ashamed to do that because they say these businesses are creating jobs. We, when it comes to our businesses, and I go through this as I write grants for BIPOC businesses and micro businesses, number one reason why we miss out is because we don't create jobs. Again, 92% of the Black businesses in this country sit in sole proprietorship, where you are the only person in that job, in that company.
Mhm.
Believe it or not, even the county will pay for interns, and people still don't take advantage of it. Abraham, they're basically willing to pay 3,000 or more for you to employ people in your business, but yeah, you
Wow.
still don't want to do the work of creating that infrastructure to grow your business beyond yourself. You okay from the cash register to your pocket.
Why is that? Why is that a mindset, right? In the black community, in the immigrant community, especially in the black immigrant community, in the African immigrant community. Why is that? Why is that so preparative mindset? Why is that mindset?
We don't think big enough oftentimes.
Uh-huh.
We don't think it's just that simple. We don't envision that business going beyond, especially when I see people as salon owners, right? If you're
Hmm.
the only one working in your salon, if you get old or you age out, that business is gone and it's lost to the community,
Okay.
right? And
Yeah.
our businesses are very important to our community because as a salon owner, you've been the eyes and the ears of the community. You've been a sense of safety, safe haven. A mother's probably send their children to you to wait there for them as they are in position between leaving jobs and the kids getting off of school. Is like you have been that resource. And so in trying to be more intentional in growing your business, is not just for you, it's for
Hmm.
the community as well. We benefit from you growing your business. So, don't think just about yourself right now. We don't budget. Abraham and I did a show, a couple weeks ago about budget. Businesses need to budget too. They plan for expansion. We don't plan for expansion, right? You do a business evaluation, just how you look at your budget at home. You look at the budget of your company, do a business evaluation. And I know nonprofit organizations that can help you do this for free. And so what that's going to do is going to say, okay, you know what? This is what you made in 2024. If you look at what you made basically and your expenses and your profit, this will allow you to bring on maybe one part-time employee at this amount of money an hour at this many hours a week or pay period. It
Okay.
can do that for you, right?
Okay.
And we
Okay.
don't do that.
Is it that to Andrea's point, right? Our community, we don't have a lot of there are a lot of resources out there, but our community don't know about it. Is it that we are not doing good enough jobs, right? I mean good enough education right? So like you are in that sector. I think Andrea is in is in similar field. Are you guys not doing enough to bring to bring the information back to our community to help our folks? Because it is very, I mean, you have a lot of small businesses out there, right? I mean, the mom and pop shops, right? You have, I mean, Broken Park, is becoming a hub, right, for small businesses, African small businesses. But you see, sometimes most of them are not growing. They're just there, stuck in one place. As to your point, there's no employee. There's nothing. It's said that they don't know about these things. That I mean, like the county have grant to employ folks, right? And I mean, the legislature they want you to create jobs in their, I mean, in their district. Why is it that our folks, small business owners that are Africans, don't know about it?
She's right. There's access and there's proximity to access, right?
Hmm.
And when I'm talking with legislatures and folks, I always tell them, you guys feel like, oh, because we're in proximity that we have access. No. And so I'm going to say it's 50-50. It's the community doesn't know, but some of it is the community does not take the time to share the information as well. So it's like reach one, teach one, or each one, teach one. If you know that saying, if I,
Hmm.
Denise, know about resources and I've been able to navigate those resources, why am I keeping it from Abraham? Why is it that I don't want to tell Paul? Why is it that I don't want to tell Mary, right? We have to get out of this deficit and scarcity mindset where we feel like if all of us are in the market, then we won't make money. That's not true. And
Hmm.
every time I'm talking to businesses, I'm out in the community, I tell people, wherever you see a Target, there's a Walmart. And that's intentional.
Not only that,
It's
wherever, and then not only that, there might be another grocery store or another
Thank you.
store like
There will
not
be
far from
Cub
it.
Foods.
Yeah.
Just think about, we all talk about Maple Grove. Maple Grove is oversaturated with the same franchise and even boutique businesses. Why? They all want to be around each other for a reason. It's intentional. Traffic. It's called traffic, folks. We drive traffic to each other. I see a lot of my salon owners, they'll be in a building and they'll talk to the landlord to be the only one there. Wrong.
Mhm.
Wrong. Stop it. It's 2025. If gatekeeping, it's 2025. If you're in a strip mall or you're in an office building and you are the only one there, you will continue to be the only one there and not grow. And that's wrong. Foot traffic. And then they'll be there and be like, oh, but nobody comes to patronize my business. Nobody comes here. Nobody knows you're there. If there's another business there that I can come to, then I'll be like, oh, you're here too. Because what happens? Maybe the salon doesn't service my entire family. But if you're a braider and I'm coming to the salon for my weave, I can
Mhm.
bring my daughter to you now because you're there. It's a one-stop shop for me.
Mhm.
There's a
Yeah.
barber shop there because my husband now maybe he can't get his hair cut to where I go and get my weave done. So now my husband, my daughter, everybody is getting service. We're all coming to the same building. This is why you see a lot of the same and similar businesses and company are together in the same area because they're thriving. They're
Mhm.
thriving off of each other. Multiple banks, Wells
Mhm.
Fargo, Chase Bank, US Bank, who's the other one? Bank of America. They're all in the same area, plethora of them. Huntington Bank, what used to be TCF. They're all in the same area. They're because you get pissed at one bank, you close your account, you're gonna you still want to put your money in the bank. That's the smart
Yeah.
thing to do. Go to US Bank. You mad at Wells Fargo? I'm going across the street to US Bank. I'm done with you. I
Yeah.
get done
Yeah.
with US Bank. I'm going to Huntington. I'm done with you. I'm right across the street. So
Yeah. 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 Yeah, folks. Well, if you are listening to us tonight, thanks so much for tuning in. We are discussing opportunities, right? Especially as it relates to healthcare, hospitality, immigrants, right? Immigrants, we really, really drive group in these sectors. And Miss B, my co-host here tonight, has been providing some good information, right? That's why I love this show. That's why I love Inner Cycle Podcast. I learn everything new. I learn something new every day, right? I
I
learn
know, right?
something. I learn something new every day and things like that. So that's why I really, really love this show. And I think, right, we're going to use this show to really, really provide information to our community because these are great information. Our people need to know these things, right? I mean, like the Angel is talking about gatekeeping. We need to stop this gatekeeping
Oh
mentality.
yes,
We need
yes,
to share information. To me, we need to create wealth, right? So that's why sometimes when I hear folks complaining, oh God, this country is this country is that. But it's sometimes we are our own worst enemy. We are
yes,
our own worst enemy, right?
yes.
We are not sharing information. We are not bringing each other along. We are not lifting each other up. All we want to do is tear each other down. And there's lots and lots of money, lots of opportunity in this country. So much to do.
Trillions and
Yeah.
trillions of dollars is in this
Mm.
country,
Yeah.
and you here making $1,000 and you getting you feeling you
Yeah,
feeling
don't
like you're
become
the only one.
yeah,
Yeah,
yeah, you know what I mean?
you're the
I
only
mean,
one. Yeah,
driving that Range Rover, right? And you feel you have made it, you
yeah.
feel you have arrived. Nah, that's not arrival, right? Don't take that.
No,
Or maybe
no.
you in your five-bedroom mansion, somewhere in Minnetonka, you feel you have arrived. Man, no, don't settle for that, right? There's so much
Mm-mm.
opportunity. Share information, collaborate with people, get other people involved, right? Let us become wealth creators, job creators, right? Is that we shouldn't just be
Yes.
part of the job numbers, just working. Let us be part of the job, creation business. I mean, hospitality, the hotels, and
Yeah,
things like that.
we're very educated.
Mhm.
I love us for that.
Yeah, yeah,
Okay, take that degree and become job creators now.
yeah.
I
And
love us for that. Very educated people. African immigrants are one of the most educated sets of groups of people here. But
well,
become
that's the
job
thing.
creators.
Sometimes I think sometimes we go to school too much, right? We're just learning to get jobs. So I think sometimes we go to school too much. Stop that whole school business. Stop piling on the student loan and feel that, oh no, the more I go to school, no man, it's like you said, like a lot of opportunities out there to create jobs. Like get into nonprofit, create some kind of company. I mean, combine with people. Let us combine resources and do something. You talk about, I think on one of the show, you talk about there's an African what more in going up in Philadelphia or
Oh
something.
yeah, the
Yeah,
Akana.
yeah,
Yeah, the
So
Akana
what? I mean, I
organization.
think I think that's something we should do in
They bought
Minnesota,
the whole
right?
block.
Yeah, I mean that's
They
like
bought the whole
let the
block.
West
I think
African
that's,
community come
yeah,
together and build a West African mall. How's that?
yeah,
Yeah, can we do
yeah.
that? Yeah. We all just need
I
to put
mean,
our resources
we don't
together,
even
right?
have to start. We don't have to go far because
Okay.
building takes time. Let's buy something first. Jamming Wings is for sale. Look it up. $6 million right now. Six
The
million
the
dollars
the
does
one
not
that
mean we have to pay.
the one that just built.
Yes, because as a
Why are they
business,
why are they flipping it again?
when you most businesses, when they want investors will come to you and say, what is your accession plan? They
Uh,
want to know when are you going to sell. If you think about it, right? That's also a part of the plan. You build it to sell it.
but they
You
just
build
built it
it
though.
to
Why are they
sell it.
flipping it? Why are they flipping it so soon? Or they just renovated it? I mean, obviously they just built it. Why are they flipping it? I mean, to your point, right? Maybe they just want to make some quick bucks,
So
make some profit, and
what
move
happens
on.
is,
Mhm.
let's just say maybe it cost me $2 million now, but it's worth 6 million, right? That maybe who knows what all I have in my portfolio. So just because somebody is selling something, that does not mean it's not good anymore. And that's another thing we need to be mindful for. If I'm selling it, I could probably have a lot of stuff in my portfolio. I need to offload something to be able to purchase something else. And what I'm
Good
going to
point.
do
Good
is going
point.
to use the cash from this one now to
Yeah.
buy something bigger and better.
Yeah.
If I make $6 million or $4 million off this deal, I can go buy multiple hotels. Who know what else I'm going to invest in, right? And so
Yeah.
that could be behind it. Or maybe I've lost a lot of people, maybe I've lost the passion for it. I don't care for it anymore. So let somebody else come and take it and manage it.
Okay. I think right to get folks involved or to get folks to know, I mean, a lot of these things that we are discussing tonight about, the recent jobs we put the opportunity that exists in healthcare, in hospitality. Don't you think folks like you, folks like Andrea should like maybe like do community outreach, right? Maybe like put on like how you call it, a conference or workshop to educate small businesses, right? I mean, there are a lot of opportunities out there. You guys, you know what I mean, can do X, Y, and Z. Don't you think folks like you that have wealth of information, right, that know these things should bring it back to the community?
It's funny you say that because it just right now, this moment, it made me to realize that I've been doing this for 10 years. Since
Hmm.
2015,
Hmm.
I've been working with micro businesses, intentionally African immigrants and Black businesses, in the Northwest suburbs. So when I say Northwest suburbs, you're talking the Crystal, New Hope, Robbinsdale, Brooklyn Park,
Okay,
Brooklyn Center, Coon
Maple
Rapids,
Grove,
so
Plymouth.
forth, Maple
Hmm.
Grove, Plymouth, basically your first ring suburbs. This year will make it officially 10 years, and still there's so many people I have yet to reach, right? It really takes a village. I have that village mentality, right? I hope tonight, as other people are listening, that they're gonna hear the information and they'll tell other people to reach out, right? We have community development financial institutions. They're called CDFIs. They're like smaller banks. You have CDCs, community development centers. You have women's small business centers. You have the SBA, Small Business Administration Centers, right? There's all these different places in which you can get access to capital, you can get technical assistance, you can get business training, right?
How do you
Um,
get to them though? I mean, they are there, right? It's like you're calling all these names. How do folks get to them? Do they go online? Do they walk to a physical space?
no more ever again as of today's date do I want anybody to start a business, think about doing a business without sitting. The first thing you should do on the computer is say, how can I get help to start this business? And you
Mm.
will see, you'll be amazed how many things come up. And then be even specific. How can I get help in Minnesota, in this specific state, to start this business? And you will see, it's just when I talk about it, that's why I feel like our white counterparts do such a great job. They don't do things on their own. They're always looking to see who can help them, who knows what, who is connected to who. The power of networking is so powerful, right? That's how
Mhm.
you get information. Chambers. You have the Black Business Chamber exists for a reason. That's a bunch of businesses. You have the St. Paul Chamber, you have the 94 West Chambers. These chambers are all a bunch of business owners coming together to talk to each other, to promote their businesses to each other, to grow their businesses, to grow their customers. So you have to be intentional to find the information first and foremost. You can't just get up and decide to do it on yourself by yourself. That's the first mistake we make.
Okay.
Once you decide you want to get help, for me, I work for a nonprofit organization. It's called ACER. We provide these services for free to businesses. And then there's MCCD, there's NDC, there's ADC, African Development Center. They're out in,
All the
yeah,
acronyms. Okay.
Neighborhood Development Center, African Development Center, the Minnesota Consortium of Developers. These are all folks that not only are they organizations that work with small businesses, they're banks.
Oh,
They're little,
really?
yes, yes.
So you can
So a
go. You,
community development
mhm,
financial institution, a CDFI, they're
mhm.
banks. They give loans. Women ventures, if you're a women-owned business, women venture. We're just gonna help. We've recently helped a young lady open her daycare here. She's gonna be opening soon. Excited about that. We just worked with a lady last year. She acquired a restaurant. It was already a restaurant up and going, and she bought the restaurant. She didn't say, "Oh, I'm cooking at home and now I want to open my restaurant." No, she saw one that was already up and running, been there for a long time, and she acquired the restaurant. We helped her do that. And when I said we helped her, we provided the hand holding to go through underwriting, to get the loan, that business plan, her business performer, did for her forecasting, her financial planning, accounting, bookkeeping, everything you can think about. She received all those services free of charge from our organization in order and to help her. And we're still helping her, right? You know,
Mhm.
accounting, her POS system, her QuickBooks. We had professionals, not me, I don't know everything, but we have professional people with these long experience and expertise, a professional accounting and bookkeeping person helping her with it. Somebody who's been working in development and acquisitions for a long time, he helped
Mhm.
her with that.
Mhm.
Business planning persons, people with degrees and master's degrees in business and stuff like that. They're helping and working with them
Mhm.
to do this, right? Free
Okay.
technical assistance services.
Okay. Besides ASO though, I know ASO is doing great work. I mean, you guys are doing. I mean, kudos to you guys, and you guys are focusing on our communities. Good work there. But besides ASO, is there any other organization, right, African or immigrant organization, that is focused so much on building black wealth, right? It's like helping small businesses, making sure bringing in vital information that is out there back to the community. Besides ASO, is there any other organization that's doing are you doing?
Everybody that I just listed to you, there's, like I said, African Development Center,
Uh,
ADC. They've
where is
been
that
around
located?
long. Later, it's in Minneapolis, like
Okay.
the West Bank over there, Cedar Riverside area. That's
Uh-huh.
where they're located. Um, a Somali guy, he's passed away, is the one who his name was Hussein, I think Samaka. He's the one who started the organization. May he rest in peace. But right now we have a phenomenal executive director called Nasibu. Nasibu is the ED there at African Development Center. Go see my brother Nasibu. They have a bigger budget than we do.
I
They
think
actually give
I'm
loans.
gonna bring it on this. I'm gonna bring it on the show. We're gonna bring it
Oh
on here.
yes, renewing
Yeah.
advice. I
To
see we
provide, yeah, to provide,
yes,
we need this information to come back to the community.
yeah,
Our people need to know this information, right? Is that so they can take advantage of it, right? I said, we live in the greatest and the richest country in the world. And so many like trillions that's out there to help each other, right? But to Andrew's point, we don't know about it, right? Like resources are out there, but our community don't know anything about it. So I think we should bring the ADC executive director on here, right? Like to expand on what you're just talking about because it's a good information.
yeah. I'll reach out to him, and they get these organizations. They get money from the state
Mm.
legislative dollars. They get money to lend out. So when the state wants to do money to businesses, they have a department, and that department works with CDFIs. So if you just look up, I think we have over 23 different CDFIs in the state of Minnesota that have
Do we,
state dollars to be able to give loans out to the community.
as the Liberian community or the West African community, is there any CDFI in our community? I know it's like the one, is like, is there anybody in our community that have gone that venture into that?
Not well. There's African. I don't know if there's West African, but there's AEDS, which is African Economic Development Solutions, and they're out in St. Paul. They've created what is called Little Africa. If you guys know about Little Africa, they do something every year in St. Paul. That's another
If it is
African-led.
in St. Paul, that's not West African. If it was in the Northwest suburb, then I would say it's probably, it's probably,
No,
it's probably.
but they serve our community. So they may not
Okay.
be located here, but they do serve our community as well.
Okay. Well, folks, this is our weekday segment, Business and Financial, where we discuss business, right? We discuss business opportunities, we discuss finance, we discuss, all of the things out there that's related to money, finance, and business, right? That is affecting our community, that needs to impact our community. We need to create black wealth. We need to create immigrant wealth, immigrant black wealth, and things like that. That's my passion. That's something we're really, really passionate about. And that Inner Cycle
Yes,
podcast, I mean, that is something we bring to you every Wednesday. I know it's a boring topic when you talk about money. Our people love to spend money. They love to be, they love to,
money
they love
price.
to be,
Yeah,
yeah, stuff like that, but they don't like to talk about it. They don't like to discuss it. So, and tonight we kind of a focus on healthcare and hospitality, meaning that the opportunities that what exist in the MSB provided my co-host Ms. B provided some great information tonight, man. So check it out. If you're a small business owner in healthcare or you're trying to buy a hotel, I didn't know like Hennepin County offering grants, right? To buy these facilities. Get in there, man. That's a huge money making thing. Hotel, you won't believe it. The margin on there is huge. If you
yes,
want to get the margin on hotels, right, is huge. You know what I mean? You won't believe
huge.
it. Yeah, things like that. So, but we can't keep going all night. There's a 1 hour show. So as we wrap up tonight, we hope you have learned a lot, from Ms. B, from myself, the little information we provided on here tonight. Again, right, we made a focus on hospitality and healthcare. The jobs report that came out for December, 256,000 jobs. Most of it was in healthcare for the 6,000 and then hospitality for the 3,000. But we just don't want you to be employee, right? To be employees. We want you to be business owner. When you
Yes,
see these sectors creating jobs, it means there are demand, there are opportunities out there
yes,
that instead of you being a spectator or meal being eaten for dinner, you can be the one providing the dinner, you know what I mean, and things like that. So, but anyways, it's been a great show tonight. So, Miss B, as we wrap up, what is the message you want to leave over our audience tonight as we dive into something that is very, very important, but most of our folks do not take important?
please don't do anything alone. No man is an island. God created so many of us for a reason. Whatever you want to do something, find somebody, ask somebody. If you get a lot of no's, keep asking until you find the get a yes, right?
Mm-hmm.
Look, do your research to get help, right? To get help for your business before you, because it'll save you money. The time you take now to do it right will save you money in the end, right? And you'll make money sooner rather than lose money when doing that business. So I just want you to take time to uh, think about what it is that you want to do before you take that leap out there and invest. And like he said, it's important to pay attention to the market. The market exists for a reason. The data is there for a reason. That information is not foolish. Just think, Why is the government keeping track of all of this? It's important. And so therefore you should know it as well.
Definitely, definitely. I mean, as I said, the government provides, monthly job data. The reason why they are doing that because, to your point, right, there are opportunities in there, right, and we need to show that we are discussing it, we are bringing it to our folks. I know, as I said, a lot of folks don't let to listen to it, but it's very, very important, and that's why tonight
In a
we
circle
discuss something
podcast
that we
where
feel
hearts
we
unite,
feel is going to benefit this community, it's going to
sharing our
benefit
truths,
us, and
bringing
hope you
hope
learned
to the
something from us
light.
tonight. We are here every Wednesday,
Community
mainly just
strong
discussing
and
business and
never
finance.
alone.
You can join
Yes.
us if you want to be
Together
a
as one, we'll
if you love business, if you love
create our
finance, and you
home.
want to be a
Join us.
panelist.
Join the
Yeah, join us so we
conversation,
can have
step
fun,
the
man. You know what I mean?
topic
So we can educate our
in a
community.
circle
So, but it
podcast
was
where
great
laughter
having you
flows.
tonight. Great list, great information from Miss B. For me, I don't know most of the things that go in the community, right? Is that sometimes when I'm on the show, when I'm on here, I'm learning a lot, and things like
Yeah.
that. So, but
Let's learn
thanks so
from
much.
each other and let's grow together.
Yeah, yeah, yeah. Thanks so much for joining us tonight. We hope you enjoy the show. We'll see you tomorrow here at 7:30. Tomorrow's topic is going to be loaded. It's going to be fun. So join us. Where the panel is going to be, the usual panel is going to be here tomorrow. And things like that.
I
So
will try not to be bitter.
yeah. Okay. Okay. Well,
As the
folks, thank
clock
you
strikes
so much.
7,
You have a
the
good night.
fire to
Thank you.
light.
Yeah. Okay. Good night, Miss
In
B.
a circle,
Good
sing
night.
where voices thrive.